Welcome to the 7th and final module of the course, plus Inclusive Education from Reflection to Action. The theme of this module is Inclusive Education in Practice, Students with Attention Deficit Hyperactivity Disorder. In this presentation, we will cover the following topics. Knowing to understand ADHD, diagnosis, assessment and risk factors, myths and truths, intervention strategies, learning difficulties, educational environment, classroom and recreation, pedagogical practices, teaching strategies and methods, educational resources. The objectives of this module are 7.1. Be able to recognize some features associated with ADHD. 7.2. Identify inclusive resources and good practice targeted at students with ADHD. 7.3. Identify ways to create an inclusive classroom for children with ADHD. 7.4. Adjust pedagogical-didactic practices that promote the potential of all students. We hope that by the end of this module, this sentence will make sense to you. It is not a disturbance not to know what to do. It is a disturbance not to do what you know. So let's start by getting to know to understand ADHD. It is a neurobehavioral disorder characterized by a persistent symptomatic triad of inattention, hyperactivity, and impulsivity. It starts in childhood, but in more than half of the cases, it extends into adolescence and adulthood. This is the most frequently diagnosed neurobehavioral disorder in school children. Studies show that there is a higher prevalence of the diagnosis of this condition in male children, 3 to 4 times more frequent, compared to female children. In females, the most common symptoms are inattention, with hyperactivity and impulsiveness being less intense. Given this evidence, the number of underdiagnosed cases in female children is thought to be significant. It manifests itself by inattention. That is, the difficulty in keeping attention on a task or activity until the end, difficulty to concentrate and organize, lack of care with working materials, difficulty to follow requests or instructions. However, individuals with ADHD are not devoid of concentration, this being temporarily good when it comes to a subject of their interest. Hyperactivity, characterized by restlessness, running or walking inappropriately, excessive talking, difficulty participating in sedentary activities. Impulsiveness, marked by impatience, difficulty in waiting their turn, meddling in the affairs of others, inappropriate comments, disobedience to instructions, and involvement in dangerous activities. There may also be impulsive and compulsive eating as a response to the need to calm inner restlessness or because they cannot postpone satisfying a craving. All these aspects have repercussions on the children's academic performance, social relationships, and levels of self-esteem and self-concept. The symptoms differ according to age. The baby becomes insatiable, easily irritable, and it is difficult to calm him down. He has difficulty sleeping and feeding. Early childhood is characterized by irritation, restlessness, and agitation. There is a tendency to disobedience, and the child is hardly satisfied with anything. Child, very easily distracted, unable to concentrate. He is very impulsive and may get involved in arguments. Hyperactivity may or may not appear. In the adolescent, there are problems with memory and concentration, difficulty in thinking and making long-term plans. Restlessness and impulsiveness are common characteristics too. The ADHD adult is typically impatient, restless, hyperactive, lacks concentration, is easily distracted, anxious. Many adults have difficulty maintaining relationships as they easily lose interest in the person they are meeting. Diagnosis is not straightforward and easy to reach as the symptoms are nonspecific, that is, not inherent only to this condition. On the other hand, diagnosis can become difficult since there are no medical tests, imaging, or laboratory that can accurately confirm or exclude the diagnosis of ADHD. It is important to bear in mind that the clinical picture may vary according to the age and development of the child, so the evaluation and consequent diagnosis in children at an early age should be cautious. According to DCM-5, for a diagnosis to be confirmed, the subject must meet at least 6 criteria from one of the following categories. Category 1. Inattention symptoms. Easily forgetting to carry out daily tasks. Easily distracted by irrelevant stimuli. They easily and frequently lose material needed for the activities they have to carry out. They avoid starting tasks that require too much attention. Difficulty in organizing tasks as well as activities. They do not follow instructions and do not finish tasks. Increased difficulty in concentrating on activities or tasks. Lack of focus on details. They make mistakes due to inattention. Category 2. Impulsivity and hyperactivity symptoms. Hyperactivity. Restlessness. Excessive moving of hands and feet. They don't stay seated when they should. Excessive behavior, running, climbing, for example, in inappropriate situations. Difficulty in dedicating oneself to activities in a concentrated and calm way. They talk excessively. Hasty answers. They answer before completing the question. Difficulty in waiting. Interrupt others or disturb them, interfering with the development of their activities or work. Although ADHD is mostly diagnosed at the school stage, some children may manifest characteristics at an early stage, such as difficult temperament with presence of stubbornness, challenging behaviors, presence in some situations of language delay, characteristics associated with autism spectrum disorder, learning difficulties and sensory problems. In addition to answering the items in the categories presented, let us look at the criteria for diagnosis. As I mentioned, the presence of at least 6 of the 9 symptoms mentioned in Category 1, inattention symptoms, or Category 2, hyperactivity and impulsivity symptoms, or both, is required. Symptoms must have been present for at least 6 months. Symptoms are usually experienced before the age of 7 and mostly before the age of 5. And the manifestation of symptoms must occur in at least 2 contexts or environments: school, home, or work. For there to be proof of ADHD, there must be clear evidence of the impact of the ADHD on the subject's social, academic, or occupational level. The diagnosis implies not only evidence of the severity and frequency of symptoms, but also the interference that these symptoms have in the various contexts of the subject's life: home, school, and work. The symptoms associated with this disorder tend to diminish during the student's school years, especially in terms of hyperactivity and impulsivity. However, studies indicate that the attention deficit and the easy distraction remain, leading to situations of difficulty in impulse control, as well as in complying with instructions. This reality ends up causing slowness in performing tasks and, consequently, the development of feelings of inefficiency, frustration, and low self-esteem. There are 3 types of ADHD, depending on the predominance of inattention and hyperactivity impulsivity symptoms. 1. Combined or mixed, in which both types of symptoms coexist, fulfilling at least 6 of the 9 behaviors of both categories. 2. Predominantly inattentive, when they fulfill at least 6 of the 9 inattentive behaviors, and 3. Predominantly hyperactive and impulsive, when they fulfill at least 6 of the 9 hyperactivity impulsivity behaviors. When the diagnosis of ADHD is suspected, the subject should be carefully assessed by a multidisciplinary team. Such a process should include medical assessment of the clinical history. Behavioral assessment focusing on the three components associated with ADHD. Interview directed at parents. Interview with the child or adolescent. Interview with teachers or school evaluation. Direct observation of behavior in the life context of the subject. It should be underlined that the evaluation based on the direct observation of the child's behavior may prove to be insufficient. There is no specific cause of ADHD, however, there is evidence that a combination of genetic and environmental factors may be at the root of a development of this condition. There are a number of risk factors associated with attention deficit hyperactivity disorder, namely: A. Genetic factors. The development of this condition can be explained from a genetic point of view. The probability of developing this condition is higher in case there is a family history of it. This is likely due to several genes involved. B. Pre- and perinatal factors, such as exposure to alcohol and drugs during pregnancy. C. Neurological lesions such as epilepsy. D. Family background. A disaggregated context with the presence of parental conflict. E. Mental health of parents, such as maternal depression, substance abuse, and cognitive deficits. F. Relational factors, such as severe early affective deprivation, institutionalization, family inability to understand or contain and organize the child's behavior. Comorbidities associated with this medical condition are very common. More than half of the diagnosed subjects have other developmental, psychological, or medical conditions. They are opposition disorder, behavioral disorder, developmental coordination disorder, mood disorder, depression, anxiety, specific learning disorders, obsessive-compulsive disorder, sensory problems, autism spectrum disorder, tics, Tourette syndrome, intellectual developmental disorder. We will talk a bit about each of them. You can also find out more by consulting Module 7 of the Good Practice Manual plus Inclusive Education, available on the project website. Children with oppositional disorder exhibit characteristics such as stubbornness, hostility, and often loses his temper and argues with adults, displays defiant behavior towards adults and/or refuses to comply with instructions given. He blames others for his mistakes, gets bored very easily, shows anger frequently, displays vindictive behavior. It is important that parents and carers adopt a positive behavioral approach to this situation. It is crucial that they acquire skills and strategies through effective parenting programs and participation in parents' groups in order to better deal with this reality and help their children. Behavior disorder is a condition where the child presents a persistent pattern in breaking social rules or norms. As characteristics, we can mention theft, destruction of property, assault, cruelty to people and animals. It is important that parents and carers seek training to provide them with strategies to deal with their child's challenging behavior. Cognitive behavioral therapy, CBT, and/or family therapy are also good solutions. The developmental coordination disorder is a condition that causes difficulties in coordination with repercussions in the subject's daily life. The clinical features are bad handwriting, difficulties in dressing, tying shoelaces, buttoning a shirt, using the zips of clothes, difficulty in the use of cutlery, constant struggle to use it, problems related to balance affecting the development of certain skills such as cycling. They also perform poorly in sports. An important help in these cases can be the developmental of suitable therapies provided by occupational therapists or physiotherapists. Mood disorder is a mental disorder that causes sudden and atypical changes in mood, energy, activity levels, affecting the ability to perform the tasks of daily life. From a clinical point of view, the subject may present the following symptoms. People who are going through a mania phase, which they usually present as signs, heightened feelings of euphoria, difficulties in sleeping, talking too fast on diverse subjects, presence of anxiety, irritability, and/or sensitivity, among others. People in a depressive phase generally present as signs excessive feelings of sadness, uncontrolled sleep, sleeps really well or doesn't sleep at all, difficulties in concentration, memory faults, negative thoughts, thinking about death and suicide, among others. Depression is one of the comorbidities present in children with ADHD. It is important to note that being in a depressive state transcends the state of sadness. When we talk about depression in children, we have to consider the following symptoms, stressing that they should occur over a long period of time: constant and motiveless crying, sleep problems, loss of interest in activities that were previously pleasurable, low energy, mood, and lack of appetite. The family should be alert and seek medical advice. It is also important to liaise with the school in order to better understand the child and help him or her to overcome this condition. Anxiety is characterized by the presence of feelings not only of tension, but also of concern, insecurity, and, as a rule, accompanied by physical symptoms such as an increase in blood pressure, dry mouth, among others. Specific learning disorders. Some children diagnosed with ADHD may also have language difficulties, such as dyslexia. They have difficulties with reading, writing, spelling. Children with this condition need accommodations in the curriculum so that they can achieve their academic goals. It is therefore crucial that they receive adequate support at school. To find out more, we suggest that you look at the Module 6 of the handbook, which is all about dyslexia. Obsessive-compulsive disorder, OCD, is reflective in obsessive and compulsive behavior towards something. This condition causes great distress. Sensory problems are visible in atypical sensory responses, such as exaggerated reactions to external stimuli, usually referred to as hypersensitivity. In cases of ADHD diagnosis, it is more often in the tactile system, the tendency to avoid textures and stiffness in the fabric of clothes. Hearing loss, a tendency, for example, to cover one's ears in noisy environments. For example, avoid being in places with a lot of light. Olfactory discomfort when strong odors are present. It is also important to mention that alterations in sensory modulation in children diagnosed with ADHD are related to inappropriate behavior in different environments, school, home, social environment, for example. Autism spectrum disorder, ASD. It is a neurodevelopmental disorder often present in children diagnosed with ADHD. It brings challenges on two fronts: communication and social interaction, repetitive behaviors. Learn more about this disorder by referring to Module 5 of the manual, which is entirely devoted to this topic. Tics are a condition that can include both motor tics and vocal tics. These come and go frequently and have stress at their origin. Tics include atypical repetitive movements of the body, vocal sounds such as coughing or grunting. Tourette's syndrome is a rare neurological disorder, characterized by the presence of simple or complex motor or vocal tics. Drugs are one way of alleviating the symptoms. However, other treatments may include psychotherapy and behavioral therapy. Finally, intellectual developmental disorder has as characteristics the presence of deficits, not only at functional level, reasoning, planning, problem-solving, and acquisition of learning, but also at adaptive level, personal and social independence. Here are some truths and myths about ADHD. And we start precisely with the myths, of which there are many. The most common ones for which we want to give you the correct information are: Attention Deficit Hyperactivity Disorder, ADHD, is an invented illness. Currently, this medical disorder is considered one of the most researched. It has been extensively studied, and there is scientific evidence that it causes damage to neurological functioning, motor problems, delayed neuropsychomotor development, cognitive dysfunction, loss of performance at work, and in academic activities. Attention Deficit Hyperactivity Disorder, ADHD, equals hyperactivity. These are different issues. Being hyperactive, agitated, does not mean that you suffer from this disorder. Agitation may just be a personality trait of the subject. PHDA passes with age. That would be nice, but it's not true. ADHD tends to present itself as a lifelong condition, showing chronicity and evolution throughout life. Symptoms tend to change, with a decrease in motor agitation in some cases. The symptoms inherent to difficulties in attention, behavioral self-regulation, and impulsiveness tend to persist over time or even worsen. When not diagnosed in time, ADHD may lead to other difficulties. Ritalin is the cure for PHDA. This is not true either. Ritalin is considered a psychostimulant whose active ingredient is methylphenidate hydrochloride. It is the most commonly used drug in the treatment of ADHD and can help children improve their attention and concentration and decrease their impulsive behavior. This drug is used as part of a treatment program which tends to include cognitive behavioral therapies and strategies focusing on the areas of psychology, education, and the social field. Shall we get to the truths? 1. Psychology helps but does not solve. There is a much higher referral of children for ADHD consultations in schools with greater psychological support. Psychologists can help to detect earlier, assess, and support the implementation of psychoeducational measures, but they do not cure a biological problem and do not reduce medication rates, neither in Portugal nor in any country in the world. 2. It is not a diagnosis created for the purpose of medicating children. The Portuguese Attention Deficit Society clarifies that ADHD is not a diagnosis created with the purpose of medicating normal children due to pressure from parents or teachers because of excessive competitiveness at school. On the contrary, there is today no doubt in the scientific community that ADHD is a neurobiological condition proven to be a brain disease with a marked genetic etiology involving dysfunction of several specific regions of the central nervous system, specifically the prefrontal cortex, and its connections with the basal nuclei and cerebellum. Despite the importance of environmental factors, namely the socio-familiar environment, in aggravating or protecting ADHD complaints, they are never the primary cause of its emergence. 3. Persists throughout life and can lead to problems in employment and family. It should also be noted that the brain dysfunction associated with ADHD involves important neurocognitive areas: executive function, working memories, language, attention, and motor control, impairing academic, family, occupational, and social functioning. These neurocognitive changes may persist throughout adult life with negative repercussions on productivity rates and problems at work and in the family. Adults with ADHD who have not been properly monitored participate more in antisocial activities, use more illicit drugs, are more prone to teenage pregnancy, sexually transmitted diseases, multiple traffic accidents, depression, personality disorders, suicide, and criminality. We then move on to practice with reference to some intervention strategies. First of all, it is essential the promotion of positive parenting attitudes. It is important to seek advice on the most appropriate attitudes to have with the child. Greater articulation school, family. Share information about the characteristics of the child in the two contexts. And definitely more information and capacity building, either by the family or by the teachers. We highlight some strategies to adopt at home. Understand the child's strengths and weaknesses. To do so, it is fundamental to know the child in its entirety. Accepting him or her as he or she is the starting point for understanding him or her. Parents should remain calm, avoiding moments of discussion with the child. If the child does something wrong, they should not shout. It is important to understand that shouting or punishing are behaviors that do not work and will only harm the child. As parents of a child with ADHD, you should give frequent and immediate feedback since they don't always know if they are behaving well or not. Frequently use positive reinforcement as well as praising the good behavior of the child. Establish well-defined rules as well as set limits. Convey to the child that they don't like the child's misbehavior and don't pass on the idea that they don't like the child as a person. They should use reward instead of punishment. Good behavior should be rewarded by, for example, allowing the child to do something they like. Material rewards should not be used. Seek out programs which aim to acquire relationship-enhancing strategies. These are seen as important tools in managing the relationship with children with ADHD. In the Good Practices Handbook, we suggest some international programs and others specific to Portugal and Spain. Respect the child's rhythm. Avoid arguments and shouting. Punishments will only harm the child. Seek further help. As parents, it is important to acquire strategies to reinforce the relationship with the child. There are specific parenting programs. We highlight some strategies to be adopted in the school. Enhancing the relationship with the reference figure, teacher, educator. To carry out pedagogical assessment for the development and implementation of a study plan suitable to the student's real needs and interests. To assess the presence of difficulties and require specific intervention such as speech therapy, psychomotor skills, for example, and seeking help and more information on the subject is also differentiated for performance as an educator. It is important to assess the possibility of implementing strategies to help control inattention, hyperactivity, and impulsiveness, behavioral therapeutic strategies, educational strategies, family therapy, etc. It is important to mention that each child is one child, with its own personal characteristics, interests, and goals, and therefore, it is up to the team accompanying the child to select and adapt the most appropriate responses. We now approach two complementary therapies. A. Behavioral therapy. This is an intervention aimed at re-educating the child in the behavioral, emotional, and cognitive domains, with the view to reducing inappropriate behaviors and enhancing adjusted behaviors. To this end, therapists use mainly playful and expressive activities. B. Cognitive behavioral therapy. This type of intervention is based on stimulating the child to use self-directed speech and self-reinforcement as problem-solving strategies, as well as motivational strategies, in order to develop self-control mechanisms of their impulsive behavior. In what concerns learning disabilities, we mentioned some characteristics associated with the problems previously referred to which teachers and parents should be aware of. ADHD has implication for learning acquisition as well as for language. Children diagnosed with this condition usually have difficulties in writing, reading, and mathematics, not because they have inferior intellectual capacity, but because of the attention, hyperactivity, and impulsiveness problems characteristic of this disorder. Reading and writing. Difficulty in recognizing words by their shape. Difficulty in reading comprehension. Comprehension problems due to poor working memory. In mathematics, the majority of students with this disorder have difficulties at the level of mental calculation. Difficulty in specific areas of mathematics in some cases. Presence of dyscalculia in some cases. Orality. They express themselves in a very particular way. Difficulties in expressing oneself orally due to difficulties at the level of attention, memory, and executive control. Difficulty in selecting the contents to express. They get lost in details. Discourse is often interrupted by hesitations such as which serve as a stick to disguise the difficulty in finding the right word. Difficulty in adapting speech to the occasion and the interlocutor due to lack of vocabulary and oral language skills. It is fundamental that children with this diagnosis receive the appropriate attention and monitoring so that their normal development is not conditioned. Inadequate and untimely intervention can lead to low self-esteem on the part of the student, difficulty in the acquisition of learning, presence of emotional problems, difficulty in the relationship with family members and peers. A timely and correct diagnosis, allied to an education adapted to the real needs of these children, are essential factors for them to develop positively and happily. We will now address what is the most favorable educational environment for students with ADHD, thus leaving some suggestions for adaptation and improvement. Students with attention deficit hyperactivity disorder are challenged daily in various contexts, including the educational context. Therefore, it is crucial to adopt a set of strategies so that these children are included and feel happy and fulfilled in the school environment. Let us look at the following strategies. Seating the student close to the teacher and away from sources of distraction, windows, radiators, fans. Have and regularly remind clear rules of operation, with the aim of providing a calm classroom environment, preferably with a small class size. To have a specialized educational support, always taking into account the student's needs, interests, and potential. To provide a specific place where the student can develop their work in isolation if necessary. Work during the morning, especially assessment and tasks requiring more concentration. With regard to physical and mental organization, keep the student's work area free of unnecessary material and support the organization of thinking. When we think about the classroom environment, we can always plan educational activities that include some motor activity. Always encourage the student to participate without forcing them to do so. Grant several moments of pause and whenever the student needs it. Take care to give short, clear instructions, repeating them several times. In addition, they are considered good classroom practice to review the material given the day before in order to consolidate the material. Allow extra time to finish tasks. Use appealing materials such as presentations, drawings, objects, etc. Be careful to use visual stimuli and write slogans on the board while talking about a certain topic. Ask, whenever possible, for student participation. Use visual organizers. Make use of group or peer learning. Propose performing tasks such as erasing the blackboard or other exercises aimed at reducing tension, moving your feet, scribbling in a notebook, for example. Allow the student to carry out the assessment over several moments, allowing them short periods of concentration. It is important to remember that children with ADHD need routines and tend to show resistance to the unexpected. It is essential to draw up a daily plan containing the activities and tasks to be developed by the student. It is also important to inculcate in the child the habit of making lists regarding the tasks to carry out each day, as well as the material he needs to carry out such tasks. The presence of unstructured times may be harmful to children diagnosed with ADHD, since they may lead to difficulties in self-control and self-management of emotions and behaviors. Thus, when students are enjoying the playground space, it is essential to encourage structured activities such as traditional games, skipping rope, among others. These work very well with primary school students. Taking a very practical approach to inclusive pedagogy with students with ADHD, we suggest some pedagogical practices. Practices that help the student at memory level. Ask the student to repeat the instruction given by the teacher or to share it with a classmate before the task is performed, so as not to forget it. During or at the end of the tasks, positively reinforce the student. It is important to note that this behavior by the teacher should be continuous and immediate. not criticizing or pointing out the errors inherent in the student's performance. Assign the student and the rest of the class varied tasks. Providing the opportunity for the student to choose the activity he wants to develop arouses the student's interest and motivation. Use visual and/or oral signals previously agreed with a student in order for the student to understand what the teacher wants from him or her. For example, the tap on the shoulder of the student can mean a request to return to focus. Practices that support information processing. Labels. Underline the most important parts of a particular task. This suggestion is also valid for the written assessment moments. Use graphic organizers so that the student better understands the task. Allow diversified assessment moments, oral presentations, manual work, for example. Encourage the use of technology that can assist the student in the acquisition of learning, focus, and motivation. For example, using the recording of lessons or using the computer during lessons. Grant and respect breaks between tasks. For example, propose an assignment in pairs before a discussion on the topic with the whole class. Always respect the student's time when completing a task. Practices that help the study method. Share with the students strategies of study organization so that they develop with greater ease study habits. For example, encourage the use of diaries, post-it, calendars, audio reminders, or other tools, particularly technological tools. Where possible, assist the student in organizing their notebook, lockers, and desk. Propose to parents and the student himself to separate the material of each subject by colors. Encourage the use of folders so as to file all important material and not lose it. Establish a means of communication between parents and school, such as a diary. Provide time management support in carrying out time-demanding tasks. For example, when carrying out an assignment due in 30 days, the teacher should break the assignment down into small tasks. Practices facilitating self-control. Anticipate possible learning difficulties that may arise and structure solutions. Make use of audio-visual techniques to signal transitions or changes in activities or tasks. For example, talking aloud and making hand signals to remind them to change from one activity to another or the end of it. Allow the student to stand up at certain times, previously agreed with the teacher. ADHD students need motor activity at certain times, so it is crucial that the teacher considers some activities such as ask you to erase the board, ask you to fetch some material, etc. To learn more about specific good practices, namely A. Practices for Portuguese classes, B. Practices for mathematics lessons, C. Practices for physical education classes, D. Practices for science lessons, see section 7.3.1 of Module 7 of the manual plus Inclusive Education. To talk about inclusive pedagogy is to talk about continually deepening knowledge. This is intended to be just one more resource to consult. In order to promote information and empowerment of the whole educational community, we have produced an information leaflet that can be used as a resource for children and their families to learn about ADHD. This leaflet is available as an annex to the manual and can also be downloaded from the official project website. Educational resources are concrete, manipulable tools with a pedagogical purpose. They are a support whose function is to help not only the thinking but also the imagination of the student. The educational resource is not by itself something that promotes teaching. The presence of the teacher is crucial in order to provide teaching opportunities for the student. When talking about educational resources aimed at students with ADHD, we have to stress the importance of playful activities. These are beneficial for children with this condition since it promotes development, thinking, as well as concentration. The use of teaching resources is an added value for children with ADHD, as they contribute not only to the improvement of attention levels, but also to the development of creativity. In Chapter 7.3 of the manual plus inclusive education, you will find suggestions of some educational resources that are good references for use both at school and at home. Finally, we leave a survival manual for teachers with aspects that we consider key when working with students with ADHD. 1. As with other neurodevelopmental disorders, some time may elapse before a diagnosis is made. We need to be patient and try to get to know the student's difficulties as well as possible together with the family. 2. Don't wait for the diagnosis to tell you everything. ADHD is not only hyperactivity, but also leads to problems with executive function, nonverbal working, and operational memory, selective attention, sustained attention, etc. Still, often there are guidelines in the medical report that should be conducted and can be implemented. 3. As a class teacher or head teacher, I should seek reliable information about ADHD. I should know the symptoms of hyperactivity, impulsivity, and attention deficit and should seek specific knowledge and appropriate training to better adapt learning strategies. I can ask the inclusive education teacher for help. I should prepare a pamphlet or find a support of this nature and make it available at school. Training support should be requested from specialized associations. 4. As a teacher or classroom teacher, it is important to talk to the family to find out if the behavior and difficulties observed are also felt at home. Report the child for an evaluation by the school psychologist. Implement the defined measures to support learning and inclusion. 5. Work with the class on inclusion. Introduce a video and age-appropriate activities for the students in question to raise awareness. Students should be aware of the limitations and potential of this classmate. Students should know what behaviors to avoid and what behaviors to promote. There are behaviors of the teacher, the teaching assistants, and the classmates that can generate moments of lack of control on the part of the student with ADHD. This is a reminder of what should not happen. Do not ask the student to write things down. Even if they do, they may forget to refer to it. Do not ask the student to prioritize or list tasks. His brain prioritizes what is interesting to him or what he wants. One of the characteristics of ADHD is procrastination or putting off indefinitely what should be done. These students know what should be done, know when it should be done, and know why it should be done, but they can't do it. 4. Say phrases like, "Stop being lazy, pay attention, you only remember what you care about, you are cold, indifferent, you only care about yourself." We remind you that this survival guide is not a recipe. All students with ADHD are different. We should never try to change the student. The school should move itself to them. We should always believe that they are capable because they are. However, they can only show it if we give them the possibility to do it through a different pedagogical path. And so we end this module. This module is intended as an introductory course for ADHD. We recommend that the acquisition of knowledge is not exhausted here or in the manual plus inclusive education. Search the suggested references and additional resources for content to deepen your knowledge. We end with 2 suggestions for reflection. 1. What have you learned new about ADHD? 2. What changes to your teaching practice do you envisage making after this module? We hope that this module has been interesting for you and has given you not only hints, but concrete tools to work on inclusion in your school. As well as taking notes on the key learnings you take away from this video, we welcome your feedback on the link provided in the summary of this video. This module marks the end of a 25H course that is designed to educate and enable effective inclusive education.